Why did China suddenly go from draconian COVID restrictions to, well, anything goes? The nation where the coronavirus originated kept a lid on it for 3 years. And an easing was expected after the October Communist Party Congress. But to go from COVID protests in November to suddenly opening the floodgates, as it will, and stopping the count on casualties, well, that makes for a stunning U-turn. Will history see this as this moment as a sort of a painful interlude before China resumes its unstoppable path to being the world's biggest economy, or a tipping point where China perhaps broke its social contract between citizens that stay out of politics and a state that provides for them? In India, Europe, and the US, the pandemic also accentuated inequality, sending millions back into poverty. What about China? And again, that promise to always better the lives of the masses. We'll also ask about the global response to the return of travelers. So far, no new strains out of China. But what happens when the world's most populous nation gets back on the go? Today in the France 24 debate, we're asking if China can cope. Joining us, economist Jean-Paul Chang. Welcome back to the show.
Thank you.
We welcome Jean-Baptiste Monnier, Vice President of the Asia Center think tank.
Hello, François.
Thanks for being with us. Dr. Viviane Coves-Masfetti, Professor of Public Health at McGill University and the University of Paris Descartes. Welcome back.
Thank you.
And France 24 former Beijing correspondent Charles Pellegrin, now of the Morning Business Edition fame. How are you?
Hi, François. I'm well. How are you?
All right. The France 24 debate, where you can join the conversation on Facebook and Twitter, hashtag F24debate. Yeah, the floodgates have indeed opened. Last week, our team in Shanghai filed this report, read by Yenna Lee.
Day and night, ambulance after ambulance arrives at the ER. This Shanghai hospital is one of the best in the country, and it's overwhelmed by the current surge in COVID cases. Stretchers and oxygen tanks pile up in the lobby. The day before, patients waited outside in freezing temperatures. This woman waited 7 hours to get her mother-in-law inside the building. The elder woman's condition is alarming. The virus has reached her lungs. This is where patients with less serious symptoms wait for rationed fever medication. Pharmacies have run out of stock. This hospital can prescribe it, but only 1 dose per person per day. There are more and more cases of severe COVID, especially for the elderly, who are also the least vaccinated. This 91-year-old will not survive. Crematoria are also overwhelmed. Dozens of families gathered outside this funeral home, hoping to find a slot for their deceased loved ones. Despite these scenes, most of the dead here are not being counted as COVID-related fatalities. Authorities only include those who die of pneumonia or respiratory failure.
Charles Pellegrin, they stopped the count on fatalities?
They stopped gathering as much data as they used to, and they've classified. There's a number of classifications of the seriousness of diseases, and on January 8th, COVID is going to go from category A to category B. And yes, they've stopped entirely counting every single case and every fatality. And actually, like in the last few days, they've been counting the deaths. It's a really small number compared to what we're seeing in reports in these overstaffed hospitals and mortuaries, et cetera.
Now, those images that we just saw, they're reminiscent of what we had in the Western world back in 2020. Has China seen this before, or is this new?
Well, we saw this in Wuhan in the first wave of the epidemic in late 2019, early 2020, and we saw anguished doctors at hospitals there, completely unable to handle the flow of patients. So it's not new. It's in China, but it's maybe new in Shanghai or in Beijing or in big cities that were spared at the very first bout of the pandemic. But between that first wave of COVID in late 2019, early 2020, and now, actually, you could argue that zero COVID actually worked at sparing lives and sparing China's health infrastructure.
Yeah, if we put it in perspective, zero COVID, ultimately, will it all balance out and will it have been a winning strategy?
Are you serious? I don't think that we can make such an equation. We have really to evaluate the effect of the zero COVID, not only on the disease, but on the mental health consequence, on the societal consequence, and in fact, we do not have serious evaluation about those effects. So we can count the cases. Actually, there is no doubt that, it's exploding. So nearly everybody gets the COVID.
Can it be temporary, or is this going to be something that lasts, what we're witnessing right now?
I mean, the bulk will be temporary because after some time, like every epidemic, it will go down and people will get immunization. So the problem will be, as it has been said, the aged people who are not well vaccinated. And you certainly remember the movie on England, UK, our country. I mean, that was nearly the same scenario. You saw a lot of people, old people, dying in very bad condition. And the problem in China is that you multiply the number. So, in England, they have such number of people, and then you have a lot of zero after the same number. So
yeah, we're talking about a nation of 1.4 billion. Jean-Paul Cheng, from zero COVID to those protests we saw in November to now no restrictions at all. Was there a middle ground, or was this the only way to go?
Actually, they took certain measures and the authorities hoped probably to go slowly, progressively. But when this demonstration came, showing that people cannot accept any more restriction, and also probably observing that anyway the virus was, Omicron was spreading, so assuming that the Omicron is less mortal, little than the other variant, they decide to relax completely. Plus, they try to accelerate the vaccination process for all the people, but it's it's not on time, it's too late for very aged people. But right now, things are going very fast. So many people got contaminated, got fever. I'm not talking about the specific aged people, but for the grand public in China. And actually, it's translated into fevers for a few days. After that, it's over. So I believe that maybe we are seeing a kind of one-shot measure to get everything done right now, in spite of have a endless, slow, relaxing process. That's probably the choice that the government did.
The real test, though, is going to be in the next few days, because we just saw huge waves of infections happen in the big cities, and now we're going to see these same waves go into rural areas with a lesser health infrastructure and poorer social levels. So in the next few days, we'll see how that affects that kind of population in different surroundings as well. So it's really far from being over. We're still going to see more infections and more anguish.
Yeah, and we heard Viviane comparing with what we experienced here in Europe at the outset of the pandemic. For those around this table who remember the spring of 2020 and how overwhelmed French hospitals had to ferry patients by train to other cities, well, spare a thought, and Charles is mentioning it there, for those who live outside of China's big metropolis. As you see on this map published by the Financial Times, the disparity between city and country folk when it comes to the numbers of doctors. And so I wonder, Jean-Baptiste Monnier, the next few days are going to be crucial, says Charles Pellegrin. You agree with that?
I agree, and it may last for months. I think we don't know how thick this wave is going to be. We pretty much know when it's going to stop, and that's a date on it, March 5th, which is the opening of the People's Congress. We'll get back to that. But what we're seeing is very similar to what we saw in Hong Kong in March and April this year. Same virus, same people. In the case of Hong Kong, they were unprepared, but it was not a central decision. In this case of Beijing, it is a decision they made. Hong Kong had 10,000 dead for 7 million people. If you scale that up to China, it's 1 to 2 millions maybe. So it's going to be ugly, and it's going to take a while because it's going to jump from cities to village.
Have you any idea when it comes to how public opinion feels about it, about the risk versus the cost? Because here in France, what we saw was there was those who were against COVID restrictions were very vocal. They came out in March, but there was a silent majority that was in favor of the government's policy. In this case,
well, there was a majority in favor of the zero COVID policy in China. They were very proud of the government's action. I think that's the case. But if you look at Hong Kong again, when we saw these images in March, it's exactly the same. They had people dying in the parking areas, in the walkways. People were upset because, the Chinese culture is to protect the elderly, the Confucianism, and we'll see the same thing happening in China. So what the government is doing is rebalancing political security versus health security. And they moved the cursor, and they're into unknown territories now.
This idea of protecting the elderly.
It's very important idea, of course. I mean, but the Chinese opinion is very rich and various, and the Chinese are actually very Latin, like the French. Yeah. They've been protesting against all the restriction measures, and overnight they become against the relaxing of rules as well. So you will always have protests in the society. That's no doubt of it. Depends on which categories of people. If young people, we're talking about young people, they are so happy to go out, to go to all these festivities.
And is it true that when they watched the World Cup and saw that there were people in the stadium, they were angry?
They were watching the soccer cup, I believe. They're more interested in the exploit than to make this kind of link between etc. I don't think it's very significant, but the opinion is versatile in China. Always you got protest from the society, whatever the measures the Chinese government is taking.
Viviane Kovès-Masfety.
So I would like to come to the children's situation. As you know, they're very concerned about aged people, much more than in Europe, and that a lot of respect for them. And then you have also the children, because the children are not very well vaccinated. They were reluctant to vaccinate children. And in fact, most of the contamination are within family. So the fact that the children will not be vaccinated is a huge problem. And for them, of course, children very important, and not so many, as you know. They are small families, so the children are very much valued, in great contact with grandparents. So, all that is part of the problem.
Yeah, we were talking earlier about how it's not just to be measured in terms of how many people get sick and how many people die.
Yeah.
But the scars it leaves behind. One of the and this is again a familiar tale. China's learning system in areas where they've been swamped, going back online and dependent the quality of the broadband you have if you're having online classes, the ability to hire a private tutor in some cases, and the concern that as they return to going online, schools are having these life-defining exams, how this article poses it, and they've either been postponed or canceled. It's something that we're still figuring out here in the West, how much it impacted high school, college-age students, even younger ones. In China, there's that added pressure that most families only have one child, and there's a lot of pressure on them.
And in addition to that, you have to realize that one child out of 5 is left behind. That means it's a huge quantity of children for whom the parents are going to work somewhere else. So, it's accentuated the phenomena because some of the parents could not come back. So there were even more separations than usual, and usual is a lot.
Yeah, because there is this registration system for migrant workers. You have to... and so you can't bring your kids with you.
I mean, you could. I mean, it is a delicate choice for the family to decide if they bring the child with them. And I should add that usually they will bring the son instead of the girl, and the girl will stay left behind. So, it's not new. I mean, there is quite a lot of survey about mental health of left behind children because it is a huge issue. And definitely the COVID and the inability to travel was worsening the situation.
And if they're left behind, who takes care of them is the grandparents.
Yes.
And so you don't want them falling ill.
No.
Absolutely. There's that intergenerational household is still a very frequent and a very popular way of living in China, and that puts more people at risk, especially the elderly, who, as we've said, are not as vaccinated, not as protected against the virus as the rest of the population, especially that third booster shot that hasn't been received by at least 1/3 of the population over 60.
1/3 of the population over 60. So lots of challenges that we saw come to a head after Xi Jinping at that party congress got his third term in October. Then we saw, again, those nationwide protests in November, authorities heeding the call, loosening COVID restrictions. And in his New Year's address to the nation, Xi Jinping conceding that we're into a new phase of COVID with, quote, everyone holding on with great fortitude, urging an extra effort as, again, this is a quote, the light of hope is right in front of us.
China is such a big country. Different people will have different demands and different views on the same thing, which is normal. It is necessary to build consensus through communication and consultation.
It's a big country. You're allowed to have debates. What's your reaction when you hear those words?
Well, I think that after this opening, which is really catastrophic for many Chinese people, Xi Jinping is losing some power. And so the question now is, what's going to happen next? Of course, he's going to be the president.
He's losing some power, you're saying?
Yes, I think that he conceded the opening. That was not his choice. He was pro-zero COVID. And so there's other forces that influenced him to make this decision very quickly, without preparation, without fully planned measure. There was one person thinking, I think, before the Congress, and he got his way all the way to the Congress. But after that, when the protests started erupting, students got into the area, the economy was pretty bad. He had to listen to some of these councillors, and here comes the second man, the future Prime Minister Li Qiang, who was the steel hand, the iron fist holding Shanghai. He was the head of Shanghai. But he's got other aspects to him. He came from the Youth League, which is very much a reformist structure, such as Hu Jintao and Li Keqiang. So, and this man is also pro-business, and he was in favor of importing mRNA vaccines and dealing with BioNTech in Germany. And he failed at that, and he had to become loyalist. But probably in the meantime, between these two congresses, he's making some tracks and he's gaining some power. So we'll see what happens as he becomes for prime
So we're
minister.
seeing a burgeoning rivalry in the high halls of power as a result of what's going on. You agree with that, Jean-Paul Chang?
I'm very careful about this kind of a speculation about personal role of Mr. Xi Jinping, of Mr. Li Qiang, etc. I mean, I believe the Chinese political system and governance is based on some very strong, predictable mechanism, and it's a state decision, probably in the box for some time. It's true that till the Congress they are not going to change the policy, and it's just after the Congress they decided the 20 measures of a relaxation, and 1 month later 10 new measures.
But the protests came about because those changes didn't happen right away.
Yeah, that's exactly the thing. But again, the Chinese government is well aware of the public opinion because they are monitoring all these social networks and they know everything. All the protests I can read on WeChat every day, they can read it as well. So they know that they have to do something to relax, to calm down the stuff. So personally, I don't believe that there is kind of amateurism in the Chinese political governance, and they can take some tough decisions, quick, surprising decisions for us, but somehow they are consequently assuming them.
All right, so no amateurism is what Jean-Paul is saying. Let me ask you, who went into being correspondent there with fresh eyes, because we have a lot of the reporting we get out of China here in the West. If you haven't been there, is you have the impression that it's a well-oiled machine and that it's clinically run. And here, what we're seeing with the images we've had the last few days is chaos. We don't associate chaos with China.
There's well, you should. I mean, to a certain extent. I mean, there's an expression in China. It's chabuduo. I mean, it's like more or less. It's like there's the official narrative that things happen a certain way, and then there's the application, which is chabuduo more or less. And what we're seeing here with this sudden change of policy, this 180-degree turn, is kind of a more or less thing. They saw an opportunity to get rid of the zero COVID policy because they saw the public opinion was swaying. They also saw it was extremely costly. I mean, I think over 90% of payments to testing companies around the country by local municipalities were late towards the end because local municipalities just didn't have the funds to pay for all the mass testing that was involved. It was becoming a huge debt burden for the country. And now they were seeing increasingly people, not just the middle and upper classes in the big cities protesting, but also the migrant workers at the Zhengzhou Foxconn plant protesting about the closed loop management system at that factory over there. And there was a real struggle. Now the real problem here from a narrative point of view and from a communication point of view from the government is to do everything but say that they changed their policy because of the protests, because that would justify the idea of having protests in the first place.
So herd pride is a big issue.
Yes, and as it is for many governments around the world when it comes to these things, and it's especially the case in China. Yes.
These mRNA vaccines, which, by the way, the European Union is offering to send, right. Will the Chinese say no because it's not the homegrown vaccine?
In addition to that, I think they made an agreement with the German to make this vaccine, and they never use it. They nearly so it's very strange. But actually,
is it a question of pride?
That's interpretation.
I mean, it's been years.
The Chinese responded. They say thanks, but no thanks to the European proposal. So I was expected. I think it's definitely too late. But what's more concerning is the zero data. WHO is asking, we don't know what is the variants propagating. We don't know how many people died, how many people are tested. And if we accept Chinese people with a test done before they board their plane, I think we should ask them to have a test when they land to scan the DNA of the test and understanding if there's a new variant that comes from China. I think we should be more
Viviane Coves-Masfetti, when we're talking about data.
I think the question of the number of people who get the disease or die maybe is not so striking, but I agree with you that we need to have the DNA to follow the variant. Because, the fact that people are sick in China, in fact, we're not so concerned. I mean, we're sorry for them, but, you know...
yeah, there's a new variant right now in North America.
But, you know, a new variant, that's another matter. If the variant, you know, is not reachable by vaccine. So, you know, everybody is a bit concerned about testing DNA. And I think the Chinese, more or less...
and when you compare with 2003, when there was the SARS, how are the Chinese less open than they were when it comes to sharing information, or is it the same?
I mean, frankly, nobody knows seriously how the epidemic started. So, you know, when the WHO went in Wuhan, and, you know, they didn't
Charles was there.
Yeah, they didn't get everything. Yeah. So, you know, we cannot say that it was a totally open policy. And even including the number of deaths. I mean, you know, a lot of people were not trusting that, you know, it depends on the definition, as you said before, you know, how you classify in death certificate. So, you know, to say we had the data is very clear, that's never happened.
Jean-Paul Cheng?
Yeah, it's a sign of distrust vis-à-vis China now for sometimes in every field, not only in the sanitary, on the health side. As far as I understand, that the Chinese side never stopped exchanging information with the so-called global.
So why is the World Health Organization asking for data right now?
Yeah, they're asking, but you know that some of the message coming from WTO is to make people to forgive maybe the too pro-Chinese stance at the beginning of the pandemic. But right now, I don't think that the Chinese stopped sharing the information through the global initiative for sharing information about influenza. So they're still giving the sequence of all the virus in China. You cannot say that it's not the case. It is the case. Otherwise,
no, I am not saying that. I agree.
Okay. So what I mean is, it's a sign that 3 years on from the beginning of there's no trust, no cooperation in terms of fight against the virus in the world. I just observe that. I mean, I'm not giving any appreciation, but it's normal.
But is Beijing partly to blame? Especially, I mean, you were there following that very closely guarded fact-finding mission to Wuhan, which turned out to just be
a glorified tour visit of Wuhan, really, for that team of investigators who were brought to the markets, yes, to look at the Huanan market a year after the supposed accident happened, and also went to visit the museum that glorified the commendable efforts done by the health workers there. But it wasn't a fact-finding mission. It was a big part of it was just the communications.
Wouldn't it have been in China's interest to let them dig deeper?
Of course, it's in everybody's interest. But the Chinese stance on this matter is, why especially us? We got also an enigmatic situation in many countries. There's no such blame game against any other country. So if you want to cooperate internationally against this pandemic, maybe you should stop to just show responsible before any proof.
Jean-Baptiste Monnier?
Sorry.
François. Well, I think the lack of transparency is total. We spoke about WHO. If I used to look at a website in China which describes every sick person in every city, in every country, in every village. I mean, this site went dark in one day. No data, nothing. So transparency is an issue. It was unprepared. They should have indeed started earlier. They were surprised. Okay, that's not the end of the world, but now they have to catch up, and it'll be a while before. And so
what do you mean by catch up? You mean catch up when it comes to...
I think they should be open to what is happening. Yes, I think that's number one. And if they ask for visas, and if they ask for their tourists to not be tested, and if they want to re-engage with the world, everybody smiles when they say, "Oh, how can you not accept our tourists? We had 8 weeks of quarantine when we go to China at some point." So everybody's smiling. So they should be fair about that.
Yeah, the EU has offered again to ship the messenger RNA vaccines to China. European health authorities meeting Wednesday in a bid to coordinate the response. The European Commission says there's an overwhelming majority of countries that agree on a joint approach when it comes to incoming travelers who've been raring to get out. Must be said, for 3 years, countries like Spain have made masks mandatory on flights out of China, with PCR tests before, and like here in France, random tests for some of the travelers to check for new variants. Moves, as was just said there by Jean-Baptiste, that are being met with suspicion in Beijing.
We are willing to strengthen communication with the international community and work hard to overcome the epidemic. In the meantime, we believe that some countries have taken entry restrictions targeting China. This lacks scientific basis, and some practices are unacceptable. We firmly oppose any attempts to manipulate epidemic prevention measures in order to achieve political goals. We will take countermeasures based on the principle of reciprocity.
Charles Pellegrin, what do you make of that statement there?
Well, it might very well be true that there is a political element to the European and American response to this new wave of infections in China, but it's a two-way street, and the conversation's been completely, basically, made toxic over the last 3 years since the virus appeared. I mean, China might be saying that and might be political, but it's worth noting that even beyond that January 8th deadline, where centralized quarantine will be lifted for inbound travelers to China, you still need a negative PCR test before you get on the plane, which is what France is doing. So it's actually quite reciprocal. And, tourists can travel to the European Union right now, including from China. It's still not possible as a tourist to go to China from the European Union on a tourist visa. That's still not happened yet.
Jean-Paul Chang?
As far as reciprocal, I mean, nothing to say. Some European governments are completely entitled to take the same kind of measures. I mean, but again,
Should European tourists be allowed to return to China?
I believe they still have some obstacle to get freely to China right now. So somehow, it's. We're talking about distrust. It will be very long before.
Is it a storm in a teacup, Viviane?
I mean, what I would like just to say is the question of scientific evidence about some danger. In reality, actually, nobody could really state that the variant in China are not arriving in France. I mean, it's already there. So, there is no document today to say that the Chinese are more dangerous than anybody else. However, what is true is that it's become a very subtle situation in the sense that they're not very much immunized. There will be a lot of cases, so with a lot of variant, and it's true that for epidemiologists, is a situation that you have to watch. But, the day we are talking today, there is absolutely no argument that their variants are more dangerous. Already, the variant B that everybody talk about is there, is in France. So I think what is very, very important is to sequence, to get the DNA, and to do that in cooperation in case something new happens.
So the more transparency there is,
I cannot judge if it is enough or not transparency, because it's very hard to have, a real judgment about that. I just want the question of the scientific opinion about the dangerosity of the Chinese people today. I mean, today, frankly, we do not have any proof that they're more dangerous. Tomorrow they may be. They may have a specific reaction due to the low immunization of the population and, the shock of so many people having the disease, with so few people being truly immunized, may leave space for another variant. But actually, it's speculation.
It's speculation at this point.
Yeah.
Jean-Baptiste Monnier, you think one of the first countries to impose those restrictions was Italy. Italy, which home to a big textile industry near Bergamo, where there's lots of Chinese. Is this politicking, again, as was this foreign ministry spokesperson claims, or is there legitimate...
Well, remember, Italy was the first one hit back in 2020. So I think they are careful and they're nervous. And so we should have a European policy vis-a-vis China. We shouldn't have a country policy, I think. And I think that the more transparency, the more WHO requirement they feel, the more open they are vis-a-vis their numbers, the more we should be also welcoming their tourists and their business people. Yeah.
This massive COVID wave in China is also the opportunity for its rival neighbor, Taiwan, to offer, as was the case a couple of days ago, an olive branch.
We have seen the pandemic taking up momentum in China. As much as the needs appear, we are willing to provide the needed assistance based on the principles of humanitarianism and help more people recover from the pandemic to have a healthy and safe new year.
So is there a silver lining to all this, Jean-Paul Chang? Will Beijing accept that offer of help?
Good.
It's a question of, I mean, Madame Tai, the president, actually is taking this opportunity to calm down a little bit
the tension.
The tension between the because she's under pressure after the last local elections in Taiwan, and because the local election based on resistance to China to defend Taiwan didn't bring her the victory she was expecting. So she's right now she's subjected to a lot of criticism, even within the DPP, her party. So that's why I believe that she's trying another speech to show that nothing is definitive. She can take some opportunity to.
And how will her words be received in Beijing?
I believe Beijing will not react at all. I mean, because Beijing. I mean, for Beijing, she's definitively independentist, so enemy. So whatever she says, I mean, Beijing don't care.
Again, it brings us back, Charles Pellegrin, to the question of how much you need to cooperate between states when it comes to dealing, because we're going to have unforeseen pandemics a lot in the future.
I mean, I think that's what the WHO has been saying since the beginning, is that the WHO can only function in its mission to prevent pandemics if all the member countries are working together. And unfortunately, when the first strand of the virus emerged in late 2019, the geopolitical scene and landscape was already too fractious between the United States and China to allow for efficient coordination on this path and on this particular question, and whether that's on one part it's China's lack of the Chinese government's lack of transparency and problems facing up to its faults in the early days of the pandemic, but then there's also a political environment in the United States that makes any coordination or cooperation with China very difficult to get through politically. So it's a really tough situation right now for that kind of work that requires coordination, across borders and across among rivals, even with a president like Joe Biden, who's supposedly more amenable to that kind of thing with China than Donald Trump was before.
Now, we saw earlier a clip from that New Year's Eve speech of China's president, Jean-Baptiste Monnier. We saw a Chinese president also promising growth. I think they were talking about 4.5%. We're back on track. Again, there's the question of what growth means and whether coming out of this pandemic, and I believe that's part of your work, there's going to be these lasting scars when it comes to China's march to what it has been very successful at, reducing some of that inequality that was there before.
Right. So we're looking at a couple of hiatus. That we had 3 years of shutdown, and now we're going to have a number of months of painful opening up when everybody's sick. I mean, the plants are just stopped because no one's there. The offices are shut down. Everybody's calling sick, and rightfully. So this will last for a while. And that created a morale issue in China. Young people are giving up. I mean, you have this lying flat idea where, hey, too much work. they're not getting married anymore. The demography is taking a hit. Unemployment is there. It's not a pretty picture. So I think there is indeed, as far as growth, a chance that they will bounce back a bit this year. Yes, I think 4.5 looks reasonable. We'll see if they reached 3% last year. I don't have the data yet. But it's kind of there's a need for motivation, if I may say. And I'm not sure that Xi Jinping has the keys for that.
Did he overstretch going with that third term? When you look at the way we talked earlier about how he's handled the pandemic?
He did, but worse than that, I think his message was Marxism. And I think that's what he wants to do in his third term. He was very clear on the podium about that.
That's good, right, for reducing inequality, if that's what he's trying to say. He's addressing the problem, right?
We don't know how Marxism works with capitalism, with healthcare, with trading, with consumption, with our French luxury goods. We don't know what it means. We have to go and revise all of our scripts because this is a new data. But it's a strong Marxism, yes.
Viviane Kovès-Masfety.
I just would like to add something. The age people today, they remember awful period. You have to realize, it was the revolution. So,
Cultural revolution.
Yeah, the cultural revolution. And, they're still there. I mean, it's not so far. So there is a sort of discrepancy between the young people who don't know that sort of things, and the age people who know that, a lot of worse things could happen. So I think it's interesting to see how this will play, because actually, of course, the young people, they sometimes a unique child, they had everything, they not used to have problems. And now, they are faced with problem in a country where not so long before, it was problem much more severe than what we have today. So it's interesting to see, to have a vision of what is that country.
Does the country's leadership, do they get this generation gap that's described?
Yeah, of course.
They do get it.
Yeah, but I just want to add something. Before even the Cultural Revolution, we experienced, my generation, okay, the 50s, the hunger, the Great Leap Forward, the catastrophe, etc. We got 3 terrible years between 59 and 61, and later we experienced the chaos of the Cultural Revolution. We have the feeling of freedom, the freedom to go to kill your neighbor or being killed by him. So all this is in the Chinese, in my generation's memory still.
Absolutely.
And
even the young people?
Young people is different. And we got some opinion polls also in China, you trust them or not. But actually, we know that the most, critical of the regime is old people, because they say that we got a terrible fate because of this regime. But for the generation after the so-called post-90, post-millennium, etc., they are quite, happy of their life and their fate. So they don't have the same kind of automatic skepticism or opposition to this political power.
Charles Péguin?
I mean, I can only go by my own experience of then conversations I have, and anecdotes aren't data. But if anything, I don't feel like there's not necessarily a sense of optimism about the future, but there's been a disinterest in politics and the things that the government does, because the government said so. Basically, they said, "Don't worry about it. We'll take care of that stuff. We'll make sure you get enough money and you'll get prospects to have a career, and that's the deal. And you don't have to worry about this politics stuff." So you had a young generation of people, at least the millennials, who were more concerned about advancing their own life. And now we're getting to a point where the prospects aren't there anymore. And a lot of this lying flat thing is about not having prospects anymore.
So does that mean those young people will now become more interested in politics?
I think there is an awakening on, not in the sense that old people think about politics or regime change, but in terms of questioning what values in life we should have. And that will lead to some political awakening at some point down the line, but it's not the same kind of political awakening that previous generations have known.
does that mesh with what you described kind of as the blues that was felt during these 3 COVID years in China?
True, I think there's a chance for the government in terms of social contracts to catch up, because people only spend half of their salaries. They save the rest because they don't have an employment, retirement, social security, everything's missing. And I think the government has to learn the lessons of what's happened here and give people a chance to make up.
All right, we're much more to talk about as we watch the next crucial days and weeks in China. I want to thank you, Jean-Baptiste Meunier. I want to thank Jean-Paul Cheng, Charles Pellegrin, Viviane Coves-Masfeti. Thank you for being with us here in the France 24 debate.